I'm compassionate and dedicated support worker with a strong interest in helping people live as independently and comfortable as possible, comfortably and as possible. So I was drawn into this role because I genuinely enjoy working with people and making a positive difference in their daily lives. So I've been working as a support worker for 2 years in Ireland, but in my country, Uganda, I used to support and during that time, I've been working across different settings in Ireland, including residential services, day services, and community-based support.
And how are you finding that?
And this experience have helped me build strong skills in person-centered care, and communication and understanding individuals' needs. Yeah.
How have you found the difference in your home country opposed to Ireland? Do you feel that the people are different, the way of taking care of them is different?
I would not say that people are different, but I would say because in my country, it's like we speak the same language, but here it's not the same language. It's only the difference of the language, but about the person-centered care, it is the same. Because they can vary depending on the individual's needs, but it usually involves supporting people with daily living activities such as personal care, meal preparation, medication reminder, and maintaining their home environment. It also includes supporting individual to access community, like going shopping, attending appointments or social activities. Just as important is providing emotional support, promoting independence, and ensuring the person feels respected, safe, and valued throughout the day. That's it. Yeah.
And the types of people that you work with, are these people people that have families around them, or are they people that are individuals living on their own?
They have families. They have their families, but some according to like the setting, let me say a residential, you go in someone's family, like someone's home, and could be someone with her family or someone who is independent. So you need to support him or her to promote his independence, to be independent in everything. Yeah.
Would you say that's the biggest part of your role, just creating that independence in that person's
Yeah.
life?
Yeah. Because this I can say I'm not relating, but I can say that as a support worker, my bigger role is to support someone and promote his or her independence and to be respected, because some of them, they are taken as someone who can't do anything, They discriminate them, but if you promote his or her independence, he or she can get work. He can start working if he gets that independence. Leave alone, I'm okay. He gets that confidence, As we support workers, we play a key role in a healthcare team because we are often the ones who spend the most time with the individuals. or the service users. We observe changes in their physical, emotional, and their well-being, and or communication, like to communicate to this. So we promote them, we give them, we be with them a lot. A lot of time we spend with them, we we know the changes in their lives, you know. So I can
Mm.
say I play a key role. Like I spend more time with them. Changes, I observe their changes in their physical or emotional well-being. So, and me, I communicate to this to yeah. One moment that I stayed with person was supporting a client who was going through a very difficult emotional time after
Mm.
she lost her loved one. She lost her
Mm.
mommy. So I had to provide emotional support to her and listen to her. I listened to her and I encourage small steps like going for walks and encouraging other things like having some coffee with her. Like over time, I saw a positive change um, in the mood, in her mood, you know, and confident. In the meanwhile, she was down. You know, someone who everyone who loses his or her or mother or father, it is so emotional and it's not easy. So over time, I saw a positive change in in her mood. So and her confidence. It reminded me how important empathy and patience and simply being present can be in someone's life.
Mm.
Yeah. One of the biggest challenges we face is managing a complex needs, especially when individuals requires both physical and emotional support.
Mm.
It can also be challenging balancing workload, especially in understanding settings. Like in the wider industry, challenges like include limited resources, staff shortage, and sometimes not enough recognition for the important work support workers do. We're
Mm.
not recognized, you know. Person centered, focusing on empowering individuals and promoting independence rather than just providing basic cares. Like there there is also been an increase in awareness, you know, around mental health, environment, safeguarding, and dignity in care. And support workers are now expected to have more training, takes on like more responsibilities, and work closely in with municipal multidisciplinaries disciplinary teams, like, you know.
Mm.
I think better staffing level,
Like higher staffing levels, like
like better staffing levels, like ongoing training opportunities and improved
um,
pay and recognition would make a big difference.
mm.
Also, more emotional support for staff, at least, like supervision and mental health support. We go through a lot, you don't know.
Mm.
So, like mental health support, like would help prevent burnout and improve on the quality of the care we provide. You know.
Mm.
Yeah.
Of course, yeah, of
Yeah.
course. Because I mean, like in your role, you are someone that, you're sitting with people with a lot of problems all the time.
Exactly.
And
Who are
uh,
biting, hitting, like
mm,
I got many bruises, like I can say, but you live alone because sometimes he or she's not hitting you or kicking you in her own senses. No. So that's where empathy comes in, and your calmness, Yeah. And sometimes people think support workers is only about basic tasks like cleaning, personal care, but it is too much more than that. We build relationships.
Yeah.
We provide emotional support. We promote independence, which is not easy, and advocate for the individuals. It's a law that requires skills, patience, and compassion. Yeah. Let me say, I always like, if a friend like, when, hey Aisha, I want to be a support worker, I want to be like, I would say, and I always say this, that person, I would say that person, you need to be patient and empathetic and open-minded. Like, good communication is very important. Good communication is very important. It's a very key, and you should always be willing to learn, because it's not like you go in the field, you start doing your job, because these individuals, let me give an example, like, not say, like, let me say, individuals with autism. When they notice, they have that higher understanding than us, so you just need to be patient. You tell her or him, don't do this, but he knows he has to do that needs patience. You need to be patient in a way that you give her time and you give yourself time to think what is next that is going to help her. It's not always an easy job, but it is very rewarding. It's very rewarding. And if genuinely you care about helping others and making difference, it can be very fulfilling career. Yeah.